All of you know this is the hip bone. Now tell me,
Okay.
which sided bone is this?
Right-sided.
Okay, this is right-sided. That's okay. So why this is right-sided? All of you know the basic concept of the bone. That's why I will try to keep asking you. So no problem. Just tell me. This is the hip bone, right? This is the sorry. This is the hip bone. So and we are looking for looking the hip bone from the medially or from lateral lateral aspect.
Laterally.
So hip bone has three parts. This is one part. Do you know which part this one?
This is ilium.
And this one, this one,
This is the pubis.
pubis, and this one,
Ischium.
ischium. So
Ischium.
hip bone composed of three parts: ilium, ischium, and pubic part. These three parts, right? So always remember, ischial tuberosity will be lie posteriorly, and which structure this one?
Acetabulum.
Acetabulum, and acetabulum will be lie outer aspect, and this is the pubic symphysis or pubic tubercle that will lie anterior and medially. So this is the right-sided hip bone. So you will be asked which portion is this. We all of you know this is the anterior superior iliac spine, the anterior inferior iliac spine, is the posterior superior iliac spine, and this is the posterior inferior iliac spine. Are you clear up to this one?
Yes, Bhaia.
Okay, so this portion is called iliac crest. What is this? It is known as iliac crest. Okay, iliac crest have tuberosity here. We'll come to know later on. So in this bone, this part of hip bone, it has few lines. This one is called anterior gluteal line. These are very important. Just have a look. This one, and this one. There are three lines in the outer aspect of this ilium, and this one is called anterior gluteal line, and this one is called posterior gluteal line. Did you get my point? And this one is called inferior gluteal line. So how many gluteal lines are present in the hip bone? How many gluteal lines are present in the hip bone? Three. So what are those three? What are the gluteal lines?
Superior.
Superior. So not the superior, not superior sister. It is called anterior.
Sorry, anterior.
Anterior gluteal line. This is the posterior gluteal line, and this is the
Posterior gluteal line.
inferior gluteal line. Okay, I'll come to this portion later on. So this is the greater sciatic notch, and this is the lesser sciatic notch, and all of you know this is the acetabulum. Today this class will run for at least 4 or 5 hours, so be ready for this. Now this is called ischial tuberosity. This is called ischial tuberosity. So have a quick revision. Someone please tell me, what is this?
Anterior superior iliac spine.
What is this?
Anterior
inferior iliac spine.
What is this?
Posterior superior iliac spine.
Posterior superior iliac spine.
This is the posterior inferior, and this is the anterior
Anterior
gluteal
line.
This is the posterior gluteal line, and this is the inferior gluteal line. This is the ischial tuberosity, right? I'll come to this point later on. Right, now we are going to see the hip bone from medial aspect. So this is the symphysis pubis. This is the anterior superior iliac spine. This is the anterior inferior iliac spine. This is the posterior superior iliac spine. This is the posterior inferior iliac spine, and this is the greater sciatic notch. This is the lesser sciatic notch, and this is the, what is this? Ischial tuberosity. This one, the ischial tuberosity. Other than these marking, you don't have to know any other thing. You don't have to know the arcuate line, any other thing. So Don't go for the other thing. So if you do have the book in front of you, just mark those points I am marking right now. Now, someone tell me, Dr. Arnav, are you here, Bhaiya?
Yes, Bhaiya.
Okay. Tell me, rapid. Which bone is this?
Hip bone.
Hip bone, right. Tell me, which sided hip bone is this?
Right sided.
Don't look for this one.
Left
side.
Okay. Dr. Alawin Bhai, tell me, why it is the left sided? Quick, please.
Yeah. Okay, and this will be iliac spine in front, and ischium.
Ischium?
Ischium to the back.
Ischial tuberous to the back.
And acidabulum appears laterally.
Lateral, right. But tell me, what is number 5?
Anterior iliac spine.
What is number 4?
Anterior inferior iliac spine.
What is number 23rd?
Posterior superior iliac spine.
And number 22.
And 22 posterior inferior iliac spine.
Okay. Dr. Badhan, are you here? Sister, please do response if you are here.
Yes, Bhaiya.
So tell me, what is
Yes, Bhaiya.
number 21?
21 is inferior gluteal line.
Is it, sister? Just have a look here.
Sorry, posterior gluteal line.
Right.
That's posterior.
Right. So 21 is posterior gluteal line. So what is number 3? This one.
Number 3 is anterior gluteal line.
And what is number 12?
This is inferior gluteal line.
Okay, that's great. Now tell me, what is number 15?
15 is ischial tuberosity.
Right. So we have identified almost every important aspect of the hip bone. So that's clear. Now come to the another important thing. So this is the left-sided hip bone. Now we'll come to know the most important muscular attachment of the hip bone. So at first come from the anterior superior iliac spine. This is the number 10. Number 10 or anterior superior iliac spine almost has 2 important attachment. One is, all of you know, inguinal ligament starts from here. So number 10 is impression for the inguinal ligament. Here inguinal ligament inserts. And another important structure arises from the anterior superior iliac spine, and that is the muscle sartorius. So what are the attachments that are found in the anterior superior iliac spine? One is inguinal ligament, and another one is sartorius. Okay, that's good. So as we have already know that this is the, what is it, Dr. Badhan? What is this? Which line is this one?
Bhaiya, this is posterior gluteal line.
Okay, right. It's okay. So behind the posterior gluteal line, a very important muscle is originates, that is the gluteus maximus. So gluteus maximus arises from Apo?
Posterior gluteal line.
Behind the posterior gluteal line, right? It arises from behind the posterior gluteal line. Okay, Dr. Sabrina, what is this? What is this? Which line? This one?
Anterior gluteal line.
Okay, now see, it is the anterior gluteal line and this is the posterior gluteal line. So in between the anterior gluteal line and between this and the posterior gluteal line, a very important muscle originates, that is the gluteus medius. So if you are asked, gluteus medius originates from which part of hip bone? Now tell me.
It arises from in between anterior gluteal line and posterior gluteal line.
That's okay. That's the complete answer. So Dr. PC Das, tell me which part is this? I think he's not here. Someone tell me which part is this?
Anterior
Gluteal line, and this is the
inferior gluteal line.
inferior gluteal line. So from the anterior gluteal line and from the inferior gluteal line, in between the anterior and inferior, there is a very important muscle origin, that is the gluteus minimus. So you come to know that very important origin of three gluteal muscles. Dr. Manaral, have a quick answer. So gluteus maximus originates from?
Yeah.
Originates from?
Behind the posterior gluteal line.
Behind the posterior gluteal line. Gluteus medius originates from?
Between the anterior and posterior gluteal line.
Exactly. And gluteus minimus originates from?
Between the anterior and inferior gluteal line.
Very good. Very good. So now we came to know that this is the anterior superior iliac spine and this is the anterior inferior iliac spine. Anterior inferior iliac spine. So anterior inferior iliac spine also has two attachment, one nerve, one muscle and another ligament. So 19 is for the straight head of rectus femoris. Rectus femoris is very important muscle for the anterior compartment of thigh, and it has two origin. One is anterior inferior iliac spine, and another one is number 15. Number 15. So it is the acetabulum. So it is the acetabulum. So it is the upper rim of the acetabulum. So it is the straight head. This is the straight head, and this 15 is called reflected head of rectus femoris. Did you get my point, doctor? All of you, did you get my point? Number 15.
Yes.
So from the number 15, which muscle originates from?
Reflected head of the
Reflected part of the rectus femoris.
And straight head of rectus femoris originates from?
Anterior inferior.
Anterior inferior iliac spine.
Exactly. And number 9 is for iliofemoral ligament. If you don't want to remember this, not needed, it's not that much important. So we came to know very important muscular attachment and important structures from here. Now come to the number 13. Number 13 is another very important muscle that is called piriformis. Try to remember this one. This for the piriformis muscle. Now come to which structure is this? It is called
Ischial tuberosity.
ischial tuberosity. The most important muscle that arises from the ischial tuberosity, these are the muscles of the posterior compartment of thigh. Number 17 is for semimembranosus. Semimembranosus. And number 18 for semitendinosus. And obviously number 3 is for adductor magnus. Adductor magnus. These are the most important muscles that originates from the ischial tuberosity. So
18 has two muscles, right?
I didn't get.
Number 18 should have
Yes, and
two muscles,
another
right?
one is long-headed rectus femoris. Another one. I'll come to this point later on. No problem. So number 17 is for the semimembranosus. Number 18 for semitendinosus, and if you want, then you can also add long head. How many heads rectus femoris has? Long head and short head. Long head of rectus femoris. And number
Dr.
3.
I guess this is biceps femoris.
Biceps.
Exactly. Biceps femoris. Biceps femoris.
Biceps femoris.
Yes, biceps femoris. Yes. Not the rectus femoris. Rectus femoris, we have already discussed about the rectus femoris, right?
Yes, yeah.
Okay, these are biceps femoris. Yes. Yes, who is this? Please tell me, Bhaiya. Bhaiya, you have some issues with your headphone, I think. I have also noticed previously you do have some problem with your headphone. Please solve the headphone, we can hear you properly. Bhaiya, can you hear me?
Yes, I am hearing you. I
Mhm.
just wanted to one point. In BD Slovakia, we learned that ischial tuberosity we can divide into superlateral, medial, this side, and then
Bhaiya, we are not getting you. Can you guys hear Dr. Mahmudul Hasan Bhaiya?
No,
No, no.
not clear.
But you do have some issues with your headphone, I think. Okay, just you can write in our chat box. So these are the things you'll have to know from this picture. So we at first identified the important point, and now we come to know the origin of the important masses. Now have a look on this picture. Just not just have a look this picture. This picture should be at the end of this book. Just have a look of this picture. Just one important. What is this? Which point? This one?
Anterior superior spine.
So what are the structures origins from this one, Bhaiya?
Ligament.
Inguinal ligament.
Inguinal ligament and
Sartorius.
sartorius. And this is the insertion of the sartorius. Did you get my point, Bhaiya? All of you? Did you get my point?
Yes.
Okay, okay. You don't have to look for any other. And this is the rectus femoris. We are just looking the thigh from the anterior medial aspect of this is the thigh, and we are from looking the thigh from the anterior medial aspect. And this is the rectus femoris. And now tell me, rectus femoris originates from how many heads does rectus femoris has?
Two head.
Two
One is
hairs.
straight head and another is reflected head.
Short head.
Straight
Short
hairs.
head?
Straight
One
hairs.
is
Straight
No,
head and
straight
Straight
head
head
and
from the
reflected head.
inferior spine.
one
And
is
reflected head from the
upper rim of
Upper rim
one is straight head, anterior inferior spine. And another one is reflected head. It comes from the superior rim of cerebellum.
very good, very good. So this is the rectus femoris. So this is the vastus medialis. We'll come to know those later on. Just come to the next picture. So it's a very important, very important. This is the gluteal region. So gluteal region, we have come to know there are three main muscles. One is gluteal maximus, one is gluteal medius, and another one is gluteus minimus. So this is the sacrum. So we are looking from the behind, not laterally. We are looking the patient from the behind, and we are looking from the gluteal region. So the most thick muscle is the gluteal maximus. So this is the gluteal maximus. So this is the gluteal maximus. And this one is the gluteus medius. Did you get my point, Bhaiya? Did you get my point?
Yes.
And
Yes.
this one, and after that, this one is the gluteus minimus. Minimus. So have a look. This is the gluteus maximus. Gluteus maximus originates from where? From where?
behind posterior gluteal line.
Exactly.
Behind the posterior gluteal line.
Exactly.
Gluteal line.
This muscle originates from here, and it gets inserted into the femur. This is the gluteal tuberosity in the femur. Did you get my point here, everyone? Everyone?
Yes.
And have a look here. This is the gluteus medius, and this is the gluteus minimus, and this is the cut end of gluteus medius. So these two muscles inserts into the greater tuberosity, greater trochanter of the femur. Did you get my point? So now someone tell me,
Yes.
which one is the inserting point of gluteus maximus?
Gluteal tuberosity of the femur.
Gluteal tuberosity. So
Tuberosity of femur.
okay, which one is the inserting point of gluteus medius and minimus?
Greater trochanter of femur.
Okay. Now tell me, this muscle is called piriformis. We have seen the origin of the piriformis muscle. Someone please tell me from where piriformis muscle originates.
Posterior inferior iliac spine.
Exactly. We have shown this picture, right? Just a few minutes back. So this is the piriformis muscle, and piriformis muscle inserts into the also greater trochanter. So we got three muscles, almost three muscles. Most important, there are so many other muscles, inferior gemmelli, superior gemmellis, other three muscles. These are not that much important, but you have to remember three important muscles. One is gluteus medius, another is gluteus minimus, and another one is piriformis muscle. These muscles inserts into the greater trochanter. Then the trochanter, it fosters some other structures, but mainly in the greater trochanter. So now come to the piriformis muscle. So this is the which nerve? This one?
Superior gluteal nerve.
Superior gluteal nerve. And so as is the piriformis muscle, above the piriformis muscle, this nerve originates, and as it is the superiorly, so it is known as superior gluteal nerve. So superior gluteal nerve directly goes into the gluteus medius and gluteus minimus. So tell me, what is the nerve supply of the gluteus medius and minimus?
Superior gluteal nerve.
Exactly. Now this is the piriformis muscle, and which nerve? This one. Which nerve comes below the piriformis? This is the
Sciatic nerve.
sciatic nerve. And this is the inferior gluteal nerve. Inferior gluteal nerve directly goes to the gluteus maximus. So tell me which gluteus maximus is supplied by which nerve?
Inferior gluteal.
Maximus supplied by inferior gluteal nerve.
Exactly. Always remember by this way, because maximum time the candidates always mismatch this thing and they commonly do the opposite thing. That's so always remember and try to have a look on this picture. So come to this picture right now. So at first see this picture. Go to this picture. Now tell me, what is number one? What is number one?
Gluteus maximus.
Very good. The inserting point of gluteus maximus is
Gluteal tuberosity of the femur.
oh, exactly. And gluteus maximus is supplied by which nerve?
Inferior gluteal nerve.
Okay. Okay. Now tell me, which muscle this one? Piriformis muscle. So what are the structures, especially which structures comes above the piriformis muscle? So what is number 17 and 18?
Superior gluteal vessel.
Exactly, superior gluteal vessel. Exactly, but here it is not. Always remember. Okay, just wait for a while. If you see any structure and the structure is having so many branches like this way, this is nothing but nerve. Always remember, in the cadaveric picture, if you find and if you are asked any structure and that is having so many branches and these are arranged like this way, these are nothing but nerve. Okay, whatever. And it is a nerve is always in this type of things are vesical nerves. I will show you later on in the popliteal fossa. Those are very clear. But these are the vessels. So these are nothing but the vessels. Supragluteal artery and supragluteal vein. Supragluteal artery, supragluteal vein. Whatever. So what are the structures that comes below the piriformis muscle? At first, come to this structure, and you can see there are so many branches or impressions of this structure. So what is number 15?
Sciatic
nerve.
Sciatic nerve. Always remember, is the sciatic nerve. So what is number 7 or 6? Number 7 or 6? What is number 7 or 6?
Inferior gluteal vessels.
Inferior gluteal vessels. So now tell me, what is number 2?
Gluteus medius.
Gluteus
medius.
And gluteus medius have been cut and it has been reflected, and this is the gluteus medius. Now tell me, what is number 3?
minimus.
Now tell me the inserting point of gluteus medius and minimus.
Greater
trochanter.
Okay, that's good. You are performing very well, Dr. I will ask someone. I would like to ask someone. Dr. Arnav, are you here, Bhaiya? Dr. Mahathir, are you here?
Yes, Bhaiya.
Who is this? Dr. Arnav. Just
Arnav.
have a quick revision. Just tell me what is number 1? What is number 1?
Gluteus maximus.
What is
Gluteus
number
maximus.
2? What is number 2?
Number 2, gluteus medius.
And what is number 3?
Gluteus medius.
So what is the inserting point of number 1?
The gluteal tuberosity of femur.
Exactly. So what is number 11?
Piriformis.
So what is number 15?
15, sciatic nerve.
Okay, we haven't discussed about the number 13, that is the quadratus femoris. We'll come to this point later on. Whatever, this is the very important picture, and you won't get this picture in your book, but it is commonly asked in MRCS exams. So I have a very this picture is not, you won't get this picture from any other book that are available in our market. So I think you should have a very good orientation regarding this picture. It's very important. Are you clear, guys? So
Yes.
so before that, we have come to know the origin of the gluteus maximus and the insertion of the gluteus maximus, but the function of the gluteus maximus is not that much important, but the function of the gluteus medius and minimus is very important. I'll tell you why this is important. So this is the gluteus medius and this is the gluteus minimus, and gluteus maximus was supposed to be here, right? So this inserts here. So basically these two muscles inserts greater trochanter, and the function of this muscle, just think neutrally. If you pull this muscle, above, or if the muscle contracts, what will happen? It will pull this portion of the femur, and this portion comes like this. So what about the femur? What about the thigh or hip joint? What will happen?
It will be abducted.
Exactly. So the function of the gluteus medius and the minimus is the abduction of hip joint. Abduction of which joint is this, guys? Which joint is this? The hip joint. So if you pull this muscle upward, or if the muscle contracts, they will pull this portion by this way, and basically this hip joint will be rotated and will go upward, and is the abduction of the hip joint. So normally, if you want to abduct, like you are standing, this is this is Dr. Manarat. This is Dr. Manarat, and he is standing. And if he is asked to stand in one leg, if he asked to abduct is another thigh, this will be abducted like this way, and the muscle that will be responsible to abduct this muscle, what are those muscles, Dr. Manarat? What is those muscle?
Medius.
Gluteus medius and minimus. Did you get my point?
Minimus.
Did you get my point here? Okay, so
Yes.
Yes.
okay, so if a person is standing, in one leg, right? Just have a look here. Person is standing in one leg, and this leg has been lifted up from the ground. So what usually happens? So so the weight of this portion, there is no leg is present to bear this weight. That's why the body will pull or droop on this side, right? Did you get my point?
Yes.
Just if you ask to stand in one leg, and you are asked to pull another leg from the ground, so there is no leg here to bear this part, the weight of this part. That's why your body will droop on this way. But in a normal person, everyone is not pulled away, because this muscle tightly contract this way and prevents the drooping on the opposite side. Just have a look on this picture. Have a look on this picture. So this muscle, sorry, these are gluteus medius and the minimus, this muscle. So the patient has lifted his leg from the ground and his body is just drooping on this side, but is not significantly drooped because this muscle has been contracted and prevents the drooping to the opposite side. So the function of the gluteus medius and minimus. What is the function of the gluteus medius and minimus? Tell me. One is
Abduction of hip
Abduction.
joint.
abduction of hip joint, and another one is
Abduct the hip joint.
and another one is it prevents the drooping of the body to the
Prevention of dropping of the
body. So if there is any abnormalities, like there is a paralysis, so which nerve supplies the gluteus medius and minimus?
Superior
superior gluteal.
Superior gluteal
Gluteal
nerve. If the patient is having superior gluteal nerve paralysis, so will those muscles able to prevent the drooping of the opposite side?
No.
No.
So this condition is called Tenderenberg gait.
Stellar
Tenderenberg
gait.
sign. So we will discuss about the Tenderenberg gait or this thing or Tenderenberg sign in your hip joint examination. So right now just try to remember the function of the gluteus medius and minimus. These are very important. So there's the muscles we have discussed right now. Up to this one, you will get the origin of the gluteus maximus, gluteus minimus, maximus insertion, piriformis, but these are not that much important. Now come to the gluteus medius and minimus, gluteus medius and minimus, and the origin and the inserting point, and nerve supply and the function. Abducts femur of hip joint, holds pelvis on stance leg, and prevents pelvis droop on the opposite swing side during walking, and medially rotate the thigh. So did you get my point? What is the function of the gluteus medius and minimus? Someone please tell me that two function I discussed.
The hip joint and it's prevent the drooping in the
Exactly.
opposite
Just
side.
it is very clearly written here. During walking is the hip abduction. During gait, gluteus medius together with gluteus minimus supports the body while it's one leg in the air and prevents the pelvis from drooping to the opposite side. Everyone, did you get my point? And did you get the answer?
Yes.
Yes, well.
Okay, it's
Yes.
very hard to understand, but I tried my best. So what would happen if there is any paralysis of the gluteus medius and minimus? What will happen? What the gait? It is known as
Tenderenberg gait.
yes. These are called Tenderenberg sign, Tenderenberg gait, and the sign is known as Tenderenberg sign, positive Tenderenberg sign, right? If the patient just after finishing the class have a look on the net, you'll come to know what is the Tenderenberg sign or what is the Tenderenberg gait. I'll show you in our examination class. Okay, so we have discussed what clinical signs is evident with weak gluteus medius and minimus and how to test Tenderenberg gait or positive Tenderenberg sign. Damage to which nerve can produce this distinct gait? Which nerve? Superior gluteal nerve. Right. So one question: which vessel exits greater sciatic foramen from above? Above the piriformis, I think above piriformis. This is the supragluteal nerve, supragluteal vessels, and nerve also. And below the piriformis, what are the structures counts?
Inferior gluteal nerve.
Sciatic nerve.
Nerve and vessels,
And
and most importantly, sciatic nerve. These are the most important. Now there is another question, but that is not important. Cause of the Tenderenberg gait. So basically the concept is, if any problem with this one, even this muscle, it's not necessarily the problem is as it always be nerve, but that could be any pathology with the greater trochanter, any other pathology with the tendons, any other pathology with the muscles, like the patient is having myopathy, gluteus medius or minimus myopathy, patient is having any tendon avulsion and some other injuries that could also cause Trendelenburg gait. So you may have a look here cause of the Trendelenburg gait, but it's not important. Now one is very important topic, that is the iliotibial tract. Iliotibial tract. So what is this? What is this? Which portion of the bone?
Iliac crest.
Iliac crest, right? And this bone, what is this? This bone is
Patella.
yes, this patella is not showing here. I think this is the patella. This is the patella.
Lateral.
And this is the upper end of tibia, right? Upper end of, and definitely this is the lateral, and this is the medially. Did you get my point, Bhaiya? Everyone, just have a look very properly. This is lateral aspect because this is the fibula, right? Fibula lies medial or laterally? Laterally. So as this is the fibula, so definitely this is the lateral condyle of the tibia, and this is the medial condyle of tibia, right? So this might be the patella, whatever. And this is the iliac crest, and this point is known as iliac tubercle. This is called iliac crest, and this is called iliac tubercle. So basically, this is known as iliotibial tract, and iliotibial tract is extending proximally into the what is the name of this portion? I already said iliac tubercle. So it is proximally attached with the iliac tubercle of the iliac crest, and distally it is attached with the which portion, Bhaiya?
Lateral condyle of tibia.
Exactly. Lateral condyle of
Tibia.
lateral condyle of tibia. Now have a look very cautiously. Two muscles inserts into the iliotibial tract. This is called gluteus maximus. Gluteus maximus, normally this is the gluteal tuberosity, right? So this is the gluteal tuberosity. So this is the gluteal maximus. So gluteal maximus normally inserts into the gluteal tuberosity, but some fibers goes to the this tract, and this is known as iliotibial tract. And another muscle, this is a very thin muscle. This muscle is called tensor fascia lata, and it directly inserts into the iliotibial tract. So now tell me someone, please tell me someone, tell me what is the attachment of the iliotibial tract? What is the attachment of the iliotibial tract?
From distally condyle of the lateral condyle of the tibia.
Exactly. So what are the muscles that inserts into the iliotibial tract? One is
Gluteus maximus, another is
tensor fascia lata. Did you get my point, Bhaiya? So you'll be asked, you'll be shown in your exam a cadaveric picture. They will show you to identify, or they will ask what is this structure, and you will find this is nothing but iliotibial tract. So the next question will be, tell me the proximal attachment of the iliotibial tract and tell me the distal attachment of the iliotibial tract, and they will definitely ask you what are the muscles that inserts into the iliotibial tract, and what are those muscles? One is
Gluteus maximus
and tensor fascia.
exactly gluteus maximus and tensor fascia lata. So these are the thing, very important. Okay, so iliotibial tract attachment we have discussed. Muscle inserts here we have discussed. So what is the clinical significance? So what is the clinical significance? Just have a look here. It is which portion? This one. Which portion? This one. Exactly, and this muscle attached with the iliotibial tract, and it is the medial portion. So partly it is attached in the anterior part of the iliac crest, right? So and it is attached here, and it goes into the lateral condyle of tibia. So if you pull this muscle or pull this tendon, what will happen?
Flexion of the knee joint.
Yes.
Flexion or extension?
Extension.
Extension of the knee joint. Exactly. So always remember the function of the iliotibial tract is stabilizing the knee joint in extension and partly flexion. So basically its part is to give the stability of the knee joint. Always remember. But if it was supposed to be inserted here, that will definitely would do the flexion. But as it is from here like this way, so that's why it is the extension of the knee joint. Everyone, did you get my point? Everyone, did you get my point?
Yes.
Yes.
Okay. So for the clinical significance, I have discussed here. So attachment of the ischial tuberosity. Just so have a look here. So this is the ischial tuberosity. So we have already discussed mainly what are the things that are attached with the ischial tuberosity. So basically, this is for semimembranosus. This is for semimembranosus, and this is for semi-tendinosus, and another structure. What was the another structure, Dr. Anaka?
Long head of biceps.
Exactly, biceps femoris, not rectus femoris, whatever. This is the long head of biceps femoris, and another one is semi-tendinosus. And another muscle that is attached, that is the adductor magnus. This is the adductor magnus. And there is some fatty tissue, some fibrous tissue, or some bursa. These are the fatty tissue and bursa. These are. So if you ask what are the structures, this picture is taken from Gray's Anatomy. So if you are asked to or are these structures that attached with the gluteal tuberosity, just have a look on this picture. I think it would be much more handy. Okay. Okay, we have seen this thing. Now this is the marking of the sciatic nerve. This is the marking of the sciatic nerve. So they will ask you to surface marking of the sciatic nerve. Is there anyone who could tell me the root value of the sciatic nerve?
L4
Number
to
4,
S3.
5, sacral, 1, 2, 3.
Sacral. Number 4, 5.
Three.
Sacral.
Sacral, number 4, sacral 1, 2, 3.
Exactly. Sacral. Number 4, 5. Sacral 1. Just have a, just wait for a second. Okay. Okay. Sorry for the interruption. Okay. Now we are just asking the what are the root value of the sciatic nerve, and you'll have to remember those things. That is the number 4, 5, sacral 1, 2, 3. So they may ask you to go for the surface marking of the sciatic nerve. The surface marking of the sciatic nerve. So always remember, sciatic nerve basically is a curved structure like this way. Is a curved structure, and how the curves are produced. One thing, you will have to take one point in the posterior superior iliac spine. And what is this? What is this? Tuberosity. So this is the line. So at first you will take one line, that is the posterior superior iliac spine and ischial tuberosity. Then identify the midpoint of this line, right? Then you will have to take another line. One is ischial tuberosity and another one is greater trochanter, and this is the another line. So you are asked to draw a curved line in between the or midpoint of posterior superior iliac spine and ischial tuberosity, and ischial tuberosity greater trochanter is a curved line, and this is the surface marking of the sciatic nerve. Did you get my point, Bhaiya? Everyone, did you get my point?
Will you please repeat this, Bhaiya? Because I
Yes,
have
yes.
an issue.
Yes. You do have some network issue today, I have noticed. So basically they will ask you to identify the or ask you to tell the surface marking of the sciatic nerve. So surface marking, for the surface marking of the sciatic nerve, you will have to draw a curved line, and curved line is extending from first point is we'll have to take one point in the posterior superior iliac spine, and another point is ischial tuberosity. So this is the line. So you'll have to identify the midpoint of this line. So it is the first line. The second line, one point is the ischial tuberosity and another point is greater trochanter. So this is the second line, and go for the midpoint of this line. So you are asked to draw a curved line in between these two lines. This is the surface marking of the sciatic nerve. Did you get my point, everyone? Did you get my point? What is
Yes,
the surface?
sir.
So someone please tell me just what is the surface marking of the sciatic nerve? So it is the root value, and it comes from below the piriformis.
Iliac spine.
So it comes from below from the piriformis or above the piriformis?
Below.
Below the piriformis.
Below the piriformis, exactly. But there may be some variations, especially at least 30% case. I am discussing those things later on. So just someone tell me what is the surface marking. These things are discussed here, but just have a look at the surface marking of the sciatic nerve is a curved line drawn 2 points. So what are the 2 points? Halfway between the posterior superior iliac spine to ischial tuberosity, to halfway between the ischial tuberosity to greater trochanter. So exactly, everyone, did you get my point? It's very tricky, so you will have to clear this point right now. There's a curved line, and this is the sciatic nerve. Everyone, did you get my point, Bhaiya? Everyone?
Yes.
So why you are so tired today? I have just started the class, and this class might take up to 2 or 3, I think. So you are tired. So what are the variations regarding the sciatic nerve? So basically, sciatic nerves ultimately forms how many nerves? What are the nerves that are formed from sciatic nerve? Tell me.
Tibial and common peroneal.
Exactly.
Two
Tibial.
branches, yes.
So the basically tibial and common peroneal branches of basically is the normal. This is the normal, and this is the piriformis muscle. So sciatic nerve comes normally below the piriformis, but this nerve may split before coming to this muscle. Just have a look here. That could be tibial division of the sciatic nerve, and that could be peroneal division of the sciatic nerve, and tibial division pierces the piriformis muscle and came here. Just come to this portion before, and this sciatic nerve splitted, and this comes separately, and this is the sciatic nerve. This comes separately. This is the tibial division. This is the common peroneal division, and comes one from below the piriformis and another one above the piriformis. Ultimately, this joins together. Just this picture, sciatic nerve comes above the piriformis muscle. Did you get my point? Just have a look here. These are the variations, and this is not usually asked in your exam, just for your own reference. Are you clear, Bhaiya? Everyone, are you clear?
Yes, Bhaiya.
Okay.
Yes.
Now come to this picture. It's a very important picture. So could you tell me which vessel this one? This is the
Common iliac.
Artery.
common iliac artery. Exactly.
Right common iliac artery.
Exactly, right common iliac artery. Okay, Bhaiya. Iliac artery. Okay. This right common iliac artery is divided into external iliac artery and internal iliac artery. Right. The external iliac artery comes downwards, and when it crosses the, what is this?
Inguinal
Inguinal
ligament.
ligament. Inguinal ligament.
It takes the name femoral artery.
Forms the femoral artery.
Femoral
Right.
artery.
Femoral artery. Now we found the femoral artery. So in the thigh, in the upper portion of the thigh, femoral artery divides into 2 portions. One is, this is the,
Superficial.
is it superficial?
Profunda.
This is
Profunda
like
femoris.
Deep.
Deep femoral or profunda
branch.
femoris. Exactly, Bhaiya. One is deep femoral or profunda femoris, and this one is the superficial femoral artery.
femoral.
Did you get my point, Bhaiya? So femoral artery comes into the thigh, and near the head of the femur, it divides into superficial femoral artery and deep femoral artery. So the vessels that supplies the head of the femur, these are the branches from the deep femoral artery or profunda femoris.
Profound.
Did you get my point, Bhaiya? Did you get my point?
Yeah.
Okay. Just have a look. This is the thigh, or this is the femur, and the vessels and the thigh is not in the same line. The thigh, the vessels is just front to the thigh. Just this is the vessel and this is the head of the femur. So these are not in the same line. Did you get my point? It's very important because you will
Yes.
shuffle between the lateral circumflex and femur and the medial circumflex femoral artery. Just have a look. This is the femoral artery or profunda femoral artery, and this is the head of the femur. So there are two branches that commonly you will get in your exam, and you will be asked about the lateral circumflex femoral artery and the medial circumflex femoral artery. So this branch will come this way and comes up to this portion, and this branch will come this way and up to this portion. So the posterior vessel, that is the medial circumflex femoral artery, and the front one, it is the lateral circumflex femoral artery, because as this vessel at first crosses the medial portion, that's why it is called medial circumflex. And this for the remembering, I am discussing this thing for the remembering, because you shuffle this thing in your exam. So as it is firstly comes in the medially, that's why it is medial circumflex femoral artery that lies posteriorly, and another one is the lateral circumflex femoral artery. Did you get my point, by everyone? It's very important.
Yes.
All of you, I think you didn't
Yes.
get. Did you get my point? Why I'm discussing here? Just have a look here. So this is the lateral circumflex femoral artery, but it lies anteriorly. So in the angiogram, you won't be able to identify this one. So always remember the vessel that lies posteriorly, that is the medial circumflex femoral artery. So this comes here and goes posteriorly. So this is the medial circumflex femoral artery, because those things are not in the same line. So this vessel at first goes in the medially, then goes into the posterior aspect. That's why it is called medial circumflex femoral artery. And the branch that lies anteriorly, that is the lateral circumflex femoral artery. Did you get my point? So lateral and medial circumflex femoral artery originates from which vessel? Which vessel?
Profunda femoris artery, and
Profunda.
anteriorly there is lateral
Circumflex
femoral artery, and
artery.
posteriorly medial circumflex femoral artery.
So don't forget this thing, because it's very important. Okay, so there are some other branches, those are perforating branches, these are not that much important. So come to this thing, come to this angiogram. So at first tell me what is number A? What is number A?
Femoral artery.
Exactly, that is femoral artery.
Femoral artery. Yes.
Who said is the external iliac via? This is the thigh. This is the thigh, upper portion of the thigh. So this is not the external iliac artery. So this is the femoral artery, whatever. So femoral artery divides into
Superficial femoral
Superficial.
So how would you identify whether it is superficial or deep femoral artery? So always remember the calibrous one, more larger one is the superficial femoral artery, and another one is perforating vessels. These are the perforating vessels that comes from the deep femoral artery. Did you get my point, Bhaiya? And another important, there is no larger branches in the beginning of this vessel, but these are the circumflex vessels. Those vessels comes from the deep femoral artery. Did you get my point, Bhaiya? Everyone, did you get my point?
Yes.
Yes.
Okay. So this is the superficial femoral artery. This is the deep femoral artery. So what is this? Just think, this is the number D. So what is this?
Perforators.
Perforators, and this is the profunda femoris, and there is the lateral femur and middle femoral artery is overlapped or behind the bone. So this is the lateral circumflex femoral artery. Did you get my point, everyone? Did you get my point? Just tell me what is number
Yes,
D.
Yes.
So what is number D? What is this? What is this?
Profunda femoris artery.
Profunda femoris artery. Deep femoral artery, okay, no problem. Profunda femoris or deep femoral artery, that's okay. Okay, so now come to another important structure, and that is the femur. At first, tell me which bone is this? Which bone is this? Which bone is this?
right-sided femur.
Femur, right side femur. I can see this is the right sided femur. Now tell me, is why this is the right sided femur? Right sided. Why this is the right sided?